One of the things as a parent who had a baby in the NICU that I found really helpful was that the NICU nurses would try to involve me where they could. They would have me change diapers or do things like that, which was really so helpful to me. Is that something that's a pretty routine practice? And what are some of the ways? For me, I had a full term baby who is getting cooling, so the touching had to be really limited, but obviously he needed things like diaper changes, so it worked. But I know that with like micro preemies or the real little ones, that's probably a lot harder. If so, what are some of the ways in which the hospitals and as NICU nurses engage parents or kind of interact with parents in that where they're kind of struggling because they can't be a regular typical parent in that
Mhm.
scenario, and it is a real foreign feeling because I just remember that being really helpful to me, and I wondered how it scaled to scenarios that were different than mine.
Right, right. So we have this thing, it's an initiative called Family Centered Care. It's also part of neuroprotection care, which is part of our hospital, especially with your baby being cooling. Neuroprotection is so important, right? And protecting that brain. Family centered care is huge in that and family involvement. So if you have a baby in the NICU and you feel like you're not able to be the mama, ask, right? I want moms knowing how to change diapers, and I will teach you how to change a diaper so that you don't contaminate a central line, right? I will help you change that diaper. If you're uncomfortable with changing that diaper, I'm going to actually have you come in and contain your baby, whether they're cooling or a micro preemie, right? We want to contain that infant. I'll have you put your hand on top of his head and maybe on top of the belly while I change the diaper and make sure my central lines aren't being contaminated. So yes, ask to be involved. You can always take a temperature, right? Right? You can always help me take a temperature. And
I
then
did
as
that. I did that a lot. I took a lot of temperatures. I
yeah,
loved it. It was
yeah,
like one of the things I could do. And I felt
exactly.
it probably seems so silly, but it felt so to me, it was like, oh, I can be a mom right this moment.
Right,
So
exactly. Now, when they're cooling, we have an esophageal probe or a rectal probe taking that temperature for us. But once they're warmed, you
yeah.
can do that, right? So, and then in the micro preemies, we want you to come in, we want you to hand hold as far as you holding your hand, like I'm pretending I have a doll here holding. Now remember, sick babies and premature babies don't like a lot of stimulation. You'll see their vital signs change in a negative way when they're overstimulated. So no padding like with a baby, soft, calm voices, like try and control the amount of noise, although the NICU in itself is a noisy place, but we try to minimize that as much as we possibly can. So yeah, there are things that you can do. And then as your baby gets better, I'm gonna have you start feeding. And let's say your baby is not feeding in the beginning. Like I'm gonna say, Megan, your baby probably wasn't feeding while he was cooling because we are protecting the gut, right? But you're pumping and making milk, but we can put a little bit of taste in the mouth and we can have the mom do that either with just a little dropper or with a Q-tip, right? And that's another mom thing that we can do. And especially with our micro preemies as well. Some of them aren't feeding because we got to protect that gut, but we can put a couple drops in their mouth for oral care and the mom can do that with us. So we're going to teach you how to take care of your baby in ways that are developmentally appropriate for that infant and as parents are wanting to learn. Now, if we have parents that are so shell shocked and scared and they're terrified, I'm going to assess that and then I'm going to encourage them in ways to help them become that parent. So let's say I ask you, hey, you want to help me change your baby's diaper? And they're like, no, 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 I can't do that. I'm like, okay, well then can you just come in and hold his head or whatever. And then afterwards, we do very strict INOs in our ICU, ins and outs. And so I'm like, okay, I'll change the diaper, but I'm going to teach you how to weigh that diaper so you can give me that information so I can chart it. So there's little ways in the beginning that we encourage parents to be involved. And then as the baby develops and gets older, we start doing those other things like bathing, changing, bringing clothes in. Once we have central lines removed in our NICU, you can then bring your own clothing and you do all those kinds of things with your baby to promote that family bonding as appropriate for the illness upon that baby.
Thank you for answering that. And again, I think that is so great that that you guys are able to do that. I think it's so important. And do you mind speaking, a little follow-up question I had to it, do you mind speaking to kind of the scale of parents that you see? So oftentimes in my NICU groups that I've been involved in, I'll see that like there's brand new NICU parents who feel somewhat like they're probably the only NICU parents who feel afraid to touch their babies or care at all for their babies, or so that they should just instantly feel comfortable around their very sick baby. So can you speak to the spectrum of parents, and if people are kind of all over the map, and if you do encounter a lot of parents that are uncomfortable and nervous when their babies are in the NICU?
Every parent is nervous and scared when they come to the NICU, right? Even someone who may have been in the NICU before and had a baby discharged out of the NICU, and then they're coming back in for another baby in the NICU, they're scared and terrified. Um, and I have a wide range. So it's like opposite. Anyway, a wide range of like parents that are there every day, want to do everything. Like sometimes just it's too overwhelming. Like because they're so anxious and they're so um, uncomfortable that our babies feel our feelings, right? We can go back to the natural community, even right. Our babies feel their environment, they know their environment. So if I have a very anxious parent that just doesn't know how to calm down, I'm going to see that in the baby. So we have that compared to people that are completely appropriate. They want to learn, they're fine. Like we get them comfortable, they become very comfortable. And then we even have some families that are completely non-existent for whatever reason. And sometimes it's distance, like we talked about the vast area in which we cover. Like let's say this is her fourth baby, but it's her first NICU baby, and she lives 4 hours away from the hospital and she has no one to watch her other 3 children. Right. So we have a wide range, but we have a very strong social work program. And we also have a very strong child life program. So we actually have cameras now, not very many, considering we have 84 beds. We don't have enough cameras. But if we have that family that can't visit, but maybe only on the weekends or only twice a month or whatever, we have a camera we can set up on top of it. Doesn't have any audio, it's just video, and the nurse can turn it on and off as she needs to, because we're not going to show you us poking your baby. That's traumatic. And it's stressful on the nurse if she misses and then she has to poke in and the parents get mad, like, because we're not perfect. Okay. So what we do have these cameras where they can go into a website and they can look at their baby. Again, no audio, just a visual, but we have that. That's pretty new. And then Child Life will set up private FaceTimes available for like sibling visits and things like that. Because with COVID, we're still not open to children, anyone under 18 allowed on the unit. So no sibling in-person visits are happening right now, but our Child Life person will set up a time where we set up like a private secure FaceTime where they can come in and talk to their siblings, read them a book, tell them stories, and things like that. So we have that available in our NICU as well. And I think most higher level NICUs do have that.
As you were saying, a lot of different scenarios that you were just covering. And so you've probably been able to see over the years kind of best and worst setups and things like that. What would you say? I don't really know exactly how to ask what I'm trying to ask, but when parents seem really well supported, maybe by family outside of the hospital or things like that. Like for me, I remember the best thing was just we couldn't have visitors really all that much, even less so now with COVID, and I really wouldn't have wanted that, but it was really helpful just to have someone like drop snacks off to me. Like, what are ways in which you think when you see parents who are kind of like well balanced, doing well, being best able to support their baby and be there for themselves, what does that kind of support look like?
Okay, so let's start back to a little bit. Let's say you just had a baby, right?
Mm-hmm.
And you're coming in for whether it be something big like a cardiac defect, or you're
Yep.
just coming in for hyperbilly, right? Your stress
Right.
and anxiety is exactly the same no matter what. So
Yep.
when I get those parents in for the first time, I introduce myself and telling them I'm going to take really good care of your baby. It's going to be overwhelming. You're going to hear and see things that you're not going to understand. Be sure to ask questions, and you're going to hear alarms go off. And I'm going to explain to them that not every alarm means that this baby's in a catastrophic gonna die situation. So if your nurse doesn't jump up right away, don't be afraid. They know what's happening. Big piece of advice I ask parents to do is I ask them to go to the dollar store. I should just go to the dollar store and buy a bunch of these and get a little notebook and a pen, because you're going to have questions come to you at random times. And then when you get into this NICU, you're going to forget everything.
Mhm.
So I almost wish they were part of our welcome kits. Like if we could get like a big donation of like little spiral notebooks and a pen to hand to every parent, because it's so overwhelming. So it's supporting them in that way. And then I also introduce them to the entire team, which again can be overwhelming. We're going to do it in baby steps. We're not going to do it all at once. So like when your baby was cooling, your baby was automatically assigned a physical therapist. But you're probably not going to see that physical therapist until the cooling process has ended and they do their
Mhm.
assessment. Your baby is also going to be assigned a neurologist, right? That comes in and follows that baby. And so again, that notebook would help so that you can identify all these specialties that are coming in. So it's not just the nurse that's taking care of your baby in the NICU. You have a respiratory therapist, you have a physical therapist, occupational therapists work with feeding. If that feeding isn't going well, they might even send it to a speech therapist and have your speech therapist come in. We have chaplains at our hospital. We have a unit assigned chaplain, and he is amazing, and he makes contact with every family. Now, let's say you're not religious, you can tell him that and he'll totally respect that. But most people appreciate him coming around and say, I'm going to say a prayer for your baby or a blessing or whatever. We have your attendings. We're a teaching hospital. So we have the attendings, which is the big honcho in charge. We have fellows, which are pediatricians that are specializing in neonatology. We have our residents, which are pediatric doctors finishing their residency. And then we have nurse practitioners as well, advanced practice nurses that are in charge of taking the baby. So there's a huge team of people taking care of your special little one in our unit. And then we have subspecialties within the NICU as well. So we have a tiny baby unit, and that's designed for our micro preemies, anything from 23, 24 weeks gestation up until 30 weeks. Any babies born during that period of gestation at our hospital go into our tiny baby unit, which are nurses that are specially trained, like your cooling, like your ECMO, a little bit different, not as much training, but they specialize in the micro preemies and the small babies. And then we have a cardiac specialty on our unit. And then we have our neuro, which is our cooling nurses. And then again, the ECMO, like I talked about. So huge team.